Hi, I'm Garvin. This telecast is on Irritable Bowel Syndrome, or IBS. So IBS is a common disorder that affects the large intestine, or the colon. IBS commonly causes cramping, abdominal pain, bloating, gas, diarrhea and constipation. Despite these uncomfortable signs and symptoms, IBS doesn't cause permanent damage to your colon. Most people with IBS find that symptoms improve as they learn to control their condition. Only a small number of people with IBS have severe signs and symptoms. Fortunately, unlike more serious intestinal diseases such as ulcerative colitis and Crohn's disease, IBS doesn't cause inflammation or changes in bowel tissue or increase your risk of colorectal cancer. It is not an inflammatory bowel disease. In many cases, you can control IBS by managing your diet, lifestyle and stress. So the main signs and symptoms of IBS can vary widely from person to person and often resemble those of other diseases. Among the most common are abdominal pain or cramping, a bloated feeling or gas, flatulence, diarrhea or constipation, sometimes alternating bouts of constipation and diarrhea, mucus in the stool. So like many people, you may have only mild signs and symptoms of IBS. However, sometimes these problems can be disabling. In some cases, you may have severe signs and symptoms that don't respond well to medical treatment. Because symptoms of IBS can occur with other diseases, it's best to discuss these symptoms with your doctor. So the main causes. The exact cause of IBS is unknown. However, most experts believe that it may be caused by a number of interrelated factors. Possible factors include an abnormality with how the muscles move food through the digestive tract, having digestive organs that are particularly sensitive to pain, a malfunctioning immune system, a problem with how the central nervous system controls the digestive system, an unusual response to infection, and environmental, dietary and genetic factors that are not yet known. Triggers bother some and not others for reasons that still aren't clear. If you have IBS, you probably react strongly to stimuli that don't bother other people. Triggers for IBS can range from gas or pressure on your intestines to certain foods, medicines or emotions. For example, foods. Many people find that their signs and symptoms worsen when they eat certain foods. For instance, chocolate, milk and alcohol might cause constipation or diarrhea. Carbonated beverages and some fruits and vegetables may lead to bloating and discomfort in some people with IBS. The role of food allergy or intolerance in IBS has yet to be understood. If you experience cramping and bloating mainly after eating dairy products, food with caffeine or sweet-free or sugar-free gum or sweets, the problem may not be IBS. Instead, your body may not be able to tolerate the sugar or lactose in dairy products, caffeine, or the artificial sweetener sorbitol. For stress, if you're like most people with IBS, you probably find that signs and symptoms are worse or more frequent during stressful events, such as change in your daily routine or family arguments. But while stress may aggravate symptoms, it doesn't cause them. And now for hormones. Because women are twice as likely to have IBS, researchers believe that hormonal changes play a role in this condition. Many women find that signs and symptoms are worse during or around their menstrual period. And for other illnesses, sometimes another illness such as acute episode of infectious diarrhea or gastroenterology or enteritis can trigger IBS. So the risk factors. Many people have occasional signs and symptoms of IBS, but you're more likely to have IBS if you're young. Your IBS begins before the age of 35 to 50% of people. If you're female, overall about twice as many women as men have the condition. Next, if you have a family history of IBS, studies have shown that people who have a first-degree relative, such as a parent or sibling, with IBS are at increased risk of the condition. Researchers are studying whether the influence of family history on IBS risk is related to genes, to shared factors in a family's environment, or both. For diagnosis now, IBS can be diagnosed by investigating your symptoms. The following symptoms need to be present for at least 6 months: changes in your bowel habits, such as constipation or diarrhea, pain and a discomfort in your abdomen, and a bloated feeling. If you can confirm the above symptoms, then a visit to your GP is required immediately for a thorough investigation. So the conventional medicines available, because it's not clear what causes IBS, treatment focuses on the relief of symptoms so that you can live as normally as possible. In most cases, you can successfully control mild signs and symptoms of IBS by learning to manage stress and making changes to your lifestyle and diet. But if your problems are moderate or severe, you may need more than lifestyle changes. So there's anti-diarrheal medications. Over-the-counter medicines such as Imodium can help control diarrhea. There's anticholinergic medications. Some people need medications that affect certain activities of the gut and anticholinergics to relieve painful bowel spasms. These may be helpful for people who have bouts of diarrhea but can worsen constipation. For example, Buscopan. Antispasmodic medicines work by helping to relax the muscles in your digestive system. Examples of antispasmodic medicines include Colofac and therapeutic peppermint oil or Colpramin. The side effects of antispasmodic medicines are uncommon. However, people taking peppermint oil can sometimes experience occasional heartburn and irritation on the area of skin around their anus. Antispasmodic medicines are not recommended for use by pregnant women. The anti-motility medicine known as Imodium, or the chemical ingredient loperamide, is usually recommended for the treatment of IBS-related diarrhea. Side effects of Imodium include abdominal cramps, dizziness, drowsiness, skin rash, bowel obstruction, and abdominal bloating. Imodium is not recommended for use by pregnant women. The antidepressant medications. If your symptoms include pain or depression, your doctor may recommend a tricyclic antidepressant or an SSRI. These medications help relieve depression as well as inhibit the activity of neurons that control the intestines. If you have diarrhea and abdominal pain without depression, your doctor may suggest a lower than normal dose of tricyclic antidepressants, such as amitriptyline. Now, there's some natural medicines with strong scientific evidence for the following. So, soluble fibre. Psyllium husk is a soluble fibre which improved symptoms of IBS by 50% in double-blind clinical trials. And peppermint. The peppermint oil has been shown to have antispasmodic effects and can improve IBS symptoms such as cramping and bloating. Next would be probiotics. Probiotics are beneficial bacteria that help to maintain the health of the intestinal tract and aid in digestion. They also help keep potentially harmful organisms in the gut, the harmful bacteria and yeasts, under control. Findings frequently report reductions of symptoms including pain, flatulence, bloating, and stool frequency when taking probiotics to treat the symptoms of IBS. And peppermint leaf. Like peppermint oil, peppermint leaf has an antispasmodic effect and can improve symptoms such as cramping and bloating. Artichoke leaf extract. Studies in the United States have shown artichoke leaf extract reduces symptoms of IBS and improved overall quality of life. So some helpful tips. In many cases, simple changes in your diet and lifestyle can provide relief from IBS. Although your body may not respond immediately to these changes, your goal is to find long-term, not temporary solutions. So you can experiment with fibre. The best approach is to gradually increase the amount of fibre in your diet over a period of weeks. Avoid problem foods. If certain foods make your signs and symptoms worse, then don't eat them. Common culprits include alcohol, chocolate, caffeinated beverages such as coffee and fizzy drinks, and medications that contain caffeine, dairy products, and sugar-free sweeteners such as sorbitol or mannitol. Eat at regular times. Don't skip meals and try to eat about the same time each day to help regulate bowel function. Take care with dairy products. If you're lactose intolerant, try substituting yogurt for milk. Consuming small amounts of milk products or combining them with other foods also may help. Drink plenty of liquids. Try to drink plenty of fluids every day. Water is best. Alcohol and beverages that contain caffeine stimulate your intestines and can make diarrhea worse, and carbonated drinks can produce gas. And exercise regularly. Exercise helps relieve depression and stress, stimulates normal contractions of your intestine, and can help you feel better about yourself. If you've been inactive, start slowly and gradually increase the amount of time you exercise. If you have other medical problems, check with your GP before starting an exercise program. Use anti-diarrheal medications and laxatives with caution. If you try over-the-counter anti-diarrheal medicines such as Imodium, use the lowest dose that helps. Imodium may be helpful if taken 20 to 30 minutes before eating, especially if you know that the food planned for your meal is likely to cause diarrhea. In the long run, these medications can cause problems if you don't use them appropriately. The same is true of laxatives. So if you have any questions on IBS, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's pharmacy in Cork. Thank you for watching and have a nice day.